Dr. Martin Luther King Jr. said, "Of all the forms of inequality, injustice in healthcare is the most shocking and inhumane." To try and combat this inequality, in January 2020, Purdue University College of Pharmacy created the Center for Health Equity and Innovation, or CHECI, with the overall mission of addressing the needs of underserved populations locally and globally, and the ultimate vision of reducing health inequity through innovative strategies. In July of 2020, a group of students dedicated to this mission developed a student leadership group called the CHECI Student Ambassadors. These students decided to direct their service learning in two main ways, the first being towards the education of future healthcare leaders, and the second in working to directly impact the care of underserved or marginalized populations. We have identified opportunities to improve the knowledge, skills, and attitudes of fellow students through a variety of projects. We recognize that Spanish-speaking patients often experience language barriers, preventing them from accessing optimal healthcare. To bridge this gap in pharmacy, we developed a Spanish track for student pharmacists, which consists of completing a Spanish minor and participating in Spanish immersion experiential learning within healthcare settings that we identified. Additionally, in order to continually assess and improve the health equity curricular content, we have been conducting surveys to understand the perspectives of both faculty and students to get a better understanding of their perceptions and to highlight the ways in which health equity was being taught to student pharmacists. More recently, our center has expanded and been able to recruit nearly 40 students from many disciplines at Purdue who are interested in being part of the work that will address these health inequities. One of the ways that we are engaging our members is by hosting seminars where we invite distinguished leaders and alumni in health equity who are carrying out the work in this space so that we are able to learn from their initiatives and ask questions to the true experts in their respective fields. We are continually identifying community engagement opportunities to grow the skills needed to improve health equity. Additionally, we have recently partnered with educators and students at Purdue Polytechnic High School to help students develop ideas for how to enhance wellness at their school and in their community. Lastly, we have had the opportunity to work directly in gender diverse care with the goal of identifying barriers to care and improving future educational opportunities. Through this work, we have identified a barrier in the lack of preparation that many pharmacists possess in delivering gender diverse care to their patients due to not having received education in their schooling. In conclusion, we, the student ambassadors of CHECI, have demonstrated a passion and continued sense of service towards ensuring that health inequities are being reduced through engagement.